So today I'm here to do Learn at Lunch on presentation creation. I don't think I'm an expert at presenting or creating presentations or anything like that. But I was happy to do this because I do enjoy making slides and making presentations, and I don't mind presenting. And a lot of the stuff I've learned has been from people in this room or other people within Asthma and breathing as well that I've presented and taken some tips from them. So happy to impart some of that wisdom that they've given me. So first of all, I want to talk about this guy, which hopefully a lot of people here will know who he is, Steve Jobs. So one of the standout things about Steve Jobs was his presentations ability. So this was a man that would go out, tell a very good story and have some very good slides to support his story and be able to sell something to everyone, and everyone would eat it up even though there was not much difference between the last model he brought out. So very successful based on the way that he would then market the products of Apple. And it really, a lot of people do attribute to his presentation skills and his ability to tell the story. So taking some points from Steve Jobs is always a good thing because we all want to present well, even though you can use fancy images and make everything look pretty. But ideally what you want is your audience to understand what you're trying to say and for them to also retain that information when they go away too. So you can do that by making sure that your presentation, the way you've created it, is appropriate and that the way you've presented it as well. So we're all science geeks here, so I thought I'd go a little bit about, well, why is it so important to be so creative with your presentations? And the first one is information retention, which I spoke about briefly before. So 10% of information is only remembered after 3 days after you present it if you are only using written information on your slides. It jumps up to 65% when you start introducing visual parts to your presentation. So very important to not just have words on a slide, having that visual aspect to it or presenting in a visual capability is also important if you want people to remember what you just said and you want that information retained as well. And another one is being emotionally engaging. And so basically this comes from storytelling about your presentation and how you tell your story. So you want your story to be emotionally invoking because we know if you do have emotional connection to what you're trying to present, it also retains the information too. So something to point out when you are presenting information to your audience. Another one is, how much can someone really remember in a presentation? And so the average person can hold about 7 items, plus or minus 2 items or so, thanks Clark, in your memory. So you need to really, before you get any content or design your slides, really think about what those key messages that you want to portray and think about them very in a structured, well organized so that you're not overloading, the cognitive aspect of someone being in the audience. And the other one is about an isolation effect. So, we do have to go through a lot of parts in a presentation, especially if we're producing a research study, you've got to go through introduction, methods, results, and everything. But you want to make sure there are certain items that stand out. So something in your results, perhaps, the very big finding that you had, you want this to isolate and stand out. And so you've got to make sure that you do something in order for that to stand out. Otherwise, it would just get brushed along with the other information too. So science behind being creative with your presentation. So what I'm going to do next is I'm going to go through different aspects of design and how they can impact or things that you can do to improve your presentations that you create. And the number one thing is fonts. So people are very specific about the fonts that they like to use. And it's actually really important as an audience member that you read a font that's readable to you as well. So the right choice enhances readability and aesthetic appeal. Okay, so we want to make sure that the font that we've chosen, it's not going to be like that cursive kind of writing, people squinting and stuff like that. So you want to make sure that you do choose the correct one from the beginning and you do keep the same font consistent. I don't know if anyone else is like this, but if I see someone's copy and pasted that clearly because the font is different, I can pick stuff like that up. So what is actually recommended is using sans serif fonts. Thanks, Clark. Helvetica or Arial, because they're clean lines surrounding the outside of the letters. So I'll give an example later to show the difference between what something with a clean line looks like and what it doesn't look like, and the difference that you will absorb that information. And like I said, consistent font usage, it is quite frustrating when I'll also show an example of what this looks like if you're not consistent with the fonts you've used right from your first slide or to the end of your slide. You can use probably 2 different ones maximum if you're doing like a header and then the body is maybe a different font, that's completely fine. But make sure you are consistent with the headers are the same fonts and the body is the same font. And also font size is so important. Try and not make people squint. So what they generally suggest is about a 30-point size for PowerPoint presentations is good, depending on how big of an audience you're going to be presenting to. But what you should never do is reduce the font size in order to fit the content on the page. What you should be looking at is how can I reduce the content, not the font size. Okay, so it's really important that if you've got too much text in there, it's probably because you need to look at the content. The size isn't the problem. So this is an example when I asked ChatGPT to tell me something about people with severe asthma, so I didn't have to think of it from the top of my head. But you can see here that there's actually a lot of wordings because they're kind of like full sentences as well, so try and avoid using full sentences to help with font sizes. And you can see the differences between, so in the first point, experience frequent symptoms, and then the bottom point is also a different font, shortness of breath, wheezing and coughing. But you can in that experience frequent symptoms, I don't know about you, but symptoms stands out more to me than experience frequent because of the font being used, because that's Helvetica, and the other one is Times New Roman. It's because of the clarity around the letters there. So that stands out more for me, and then it's frustrating also to see that it's not the same font. Same with the last PowerPoint as well, so you can really see how that type of font chosen really stands out a lot more than the sentence above it. Whereas if you were to get all that, what I just said, and you would really apply it, this is what essentially it should look like. Nice bullet points, and then what you should be able to do as a presenter is know that what you've chosen to be as that bullet point, you should be able to speak to that bullet point. So you shouldn't have to have a full sentence to know what you're going to say. This is enough for me to know experience frequent symptoms, and I already know what the symptoms are from the beginning, so I don't need to have it listed there on the page. So this is a great example of using fonts to your advantage and making sure the content is still there, but not reducing the font size. So next one is visual appeal. So basically high contrast combinations is really needed. So you don't really see, at the end of a movie, when you see all the people that have contributed to the movie, it's always generally white font on a black background or the other way around. And that's because they want you to make sure you're able to read everyone's name, and it's because of that high contrast. So it's really important when you are choosing the color of your font or the color of your background that they're actually really contrasted so that it's apparent to the person. Some people prefer white background, black font, or some people prefer the other way, depending. A minimal palette in terms of the color that you use. So generally what's recommended is about a 2 to 3 color palette scheme in your whole PowerPoint presentation. So, for example, if you've got orange and purple, and if you chuck black in there, then you decide to go, with a rogue red as well. A lot of people will be deterred by, there's that color and color, like I said, it will evoke emotions as well. So you want to make sure you are consistent so people aren't thrown off by an introduction of a new color into your slides. And like I said, color evokes emotion, so we know if you saw red on a screen, that would evoke a different emotion if you use red on the screen, blue. So really be conscious about what emotion you want to evoke with what you're trying to say, and choose it appropriately, and know that colors do have an impact. So do a little bit of research in terms of what you basically want the audience to understand from what you're trying to say. So this is an example of contrast. So you've got grey background and a darker grey wording there. And then you've also got 2 images there as well, which is actually kind of a little bit too much for one slide. You want to be, I've used VCD for you, Jordan. So it's kind of busy, right? And not only is it busy, there's also you've got the words there. You're not going to sit there and read it. It's too hard, didn't try. you'll just be relying on what I've said as well. And also me as a presenter, I look at that and I find that hard to read also, so it's not going to help me as a presenter either. So what you want to do is you want to keep to one image per slide, something that's really going to contribute to the words that you are going to say, and key points. And you've got a high contrast there where I've used, I don't know, what would you call this color?
Keys.
Great, thanks, Doug. With white font, so you can really see, what are the words and what are my talking points to this slide there. So something to, nice, good clean up slide of that one. Oh, you like the shirt, yeah. And then you also see the color palette. The box has matched the color of the shirt also, which Microsoft PowerPoint does that very well in itself when you choose design function. It will pick up the colors that if you've chosen an image and you've gone to design, it will pick up a color that's associated with your image that you've chosen too. So it's good for that too. So make sure it's all consistent color throughout your presentation. Next is pictures and storytelling, and that appeals. This is what I spoke about with Steve Jobs, that, you want to tell a story in your presentation. You don't want to just unload all this information and no one really understands, okay, so what's the problem, what's the solution, and what's the resolution? So, and I've spoken about this before, but I use images to tell a story, and but it needs to be an image with purpose to you as a presenter, that you can look at that image and that can invoke the story that you want to tell. And then that way people can also use that image to help understand what the story you're trying to tell too. So I usually use Adobe Stock to find the images for my PowerPoint presentation. I know PowerPoint has built-in images, but Adobe Stock has the University of Newcastle has a license with Adobe Stock, and so you've got lots of free images everywhere in there. So just type in your keywords when you go into it, log into your uni account, it will pick it up and use images there specifically to what you want to try and tell in terms of the story. And obviously it's licensed in that, so you don't have to worry about copyright or anything like that. Another one which I spoke about before is avoid clutter. So don't use more than one image per slide to avoid confusion. I'll show an example of what a cluttered image versus an uncluttered image difference is, and also how you can use that to tell a story. And that obviously they need to communicate a single idea. So if you've got two ideas on one PowerPoint, probably best to stick to one idea, one image, as opposed to you trying to say what the problem is and the solution is all on one slide with two images. You're probably best off separating that. So for example, I've used these 4 images, and this is me telling a story about someone who has asthma and uses a puffer regularly, and their symptoms still become uncontrolled on a regular basis. And although these people want to be active, they find that they're using their inhalers more frequently because they are trying to do that, and it does trigger their symptoms, and as a result they become breathless. So it's too much. You don't understand from those images what the story that I'm trying to tell. But for me personally, this says more to me than that image. So if anyone, I did a 3-minute thesis and I used this image as my slide. So this is me starting to tell a story about Erica, who has severe asthma, uses all her medications but still experiences frequent symptoms. She's breathless, and people go and tell her, try and be physically active, but how could she possibly do that when she's got these underlying symptoms? We need to find better ways to manage Erica's asthma with better treatment approaches and non-pharmacological interventions. So that's what you need to find for yourself, an image that will create that story for you. And also as an audience member, you're just looking at this person and you're just like, poor Erica, we do need to find something to improve, her asthma management. So whatever works for you, this one is what works for me. Everyone will be different, obviously. With Adobe Stock, you can put so many details in terms of what you want for an image. So for example, for Erica, I chose specific keywords, middle-aged woman sitting down, slightly looking, uncomfortable, something like that. Oh no, her name is not Erica. I've given her a name. Yeah. You can make up names. This is copyrighted in Adobe. I can call her whatever I want. But yeah, like I said, whatever works for you as a presenter and whatever is going to help you invoke that emotion in your storytelling. The next one is how you lay out your slide and the art of composition. So simplicity. Always when it comes to presentation, simple is always the key. Don't try and overload it with, so many workout things and transitions and things are flying in and bouncing out. Like, just keep it nice and simple, because simplicity is what's going to get your audiences to really remember what you're doing and to really get your message across to them. Another one is visual hierarchy. So I'll explain what non-visual hierarchy and visual hierarchy looks like later. But you want to be able to, when I speak, that I'm speaking in the same order or an order that's apparent on the slide to the story that I'm telling as well. So if someone sees something on the bottom and I'm already talking about the bottom point when I haven't gone to the top point, no one's going to really follow what you're trying to say. So using your layout so that you can show visual hierarchy is really important. Another one is, which I've banged on already, is maintain a consistent design and theme. And I do pick that up. I don't know if anyone else does as an audience, if there's different change of themes in PowerPoint presentations. And, you just want to make it as easy as possible for the audience member. So this is an example of a non-simple slide. So I was told very early on when I'm presenting, don't copy and paste a table from a publication into your slides. That's, for a better term, lazy for presenting what you want to present, essentially. It's too much. Sometimes it's useful if you want to really point out certain things or show that there's an overwhelming amount of measures that you're doing or something like that, if that's the message you want to come across. But if you want to talk about the results of the table, this is too much. So instead, what I generally do now is I take away the message that I want from the table and I make it much more concise. So if I go back, this has about the publication, the participants, the control, about randomized control trial for a systematic review. But all I really wanted to talk about were the intervention characteristics and their outcomes as part of my PowerPoint presentation that I did for this presentation I had to do. So really put out the details from the tables that you want to portray the simple message that you want the audiences to have. And it doesn't take long to make a table, really. So put the effort in, is what I've been told. This is an example of a non-hierarchical slide. So the problem with this slide is, first of all, my contrast is not great on this, but you don't know where I'm going to start and you don't know which way am I going to go. Am I going to go down and then come back around, or am I going to go to the right and come back around like that? It's very hard to determine. It's not the worst way of doing it, but it is really hard as an audience member to follow where I'm going to talk, and me as a presenter to know where to start and then follow through for each box. This is a much better way of presenting that information. So I'm going to start from the top and I'm going to eventually get to the next point, and a bigger point after that. And then as I'm talking, that I'm going to talk about, how sedentary behavior is bad and what it's associated with people with asthma and what's missing and how I'm going to overcome that problem. Okay, so using that more structured approach, and there's a lot of flow art charts available in PowerPoint that you can use to help you, choose that kind of layout and help with that more hierarchy kind of thing. The next couple of things I'm going to talk about maybe a bit more about actually presenting, and it'd be good to get people's opinions on, the next couple of slides in terms of they have any tips or anything that they wanted to add in addition to what I'll talk about. So an engaging opening. So it's recommended that when you do a presentation, a lot of people might stand there, read the title of your slide, and then go straight into an introduction, about the background information. So generally, you want to, from the beginning, engage your audience. So generally think of it as a rocket ship, and you're coming off the landing. You want to go straight up, enthusiastic right from the beginning. You don't want to be traveling a long distance type of thing and kind of wait for them to start being engaging. So what I generally do is I like to actually put a lot of effort into my first title slide. I generally use a nice picture as the background, and I generally use pictures that I've taken too. So that helps me to calm my nerves, because I don't know, there's that kind of representation. It's like, oh, that's my photo. That was a lovely moment. Usually it might be like a landscape photo that I've done on a hike or something like that. It kind of invokes that nice, reduces the emotions of obviously being nervousness. Logical structure. So definitely important that when you are planning out your PowerPoint presentation is that you're not going back and forth on the idea, like it gets introduced at the beginning and then you kind of go back at it at the middle and then at the end. You want a nice logical flow of, like I said, what is the problem, what's the solution, what I'm going to do about it, and what's the resolution, basically. And a slide limit. So if someone tells you that you've got a 15-minute PowerPoint presentation, stick to 15 slides. That's probably about a general rule. For this one, I didn't give my slide limit because I know we've got an hour, but yeah, generally a presentation will probably generally be 10, 15 minutes most of the time. So stick to about 10 to 15 slides. If you've gone over, you're most likely going to go over in terms of time, and no audience member wants you to do that. And no chair wants you to do that either. Everyone wants to go to lunch that follows after, or drinks. Great, and next one is, what can you do for practice and delivery of your presentation? So rehearsal. So generally, so I didn't rehearse this presentation, but this is a fun topic, it's fine. But in other presentations, try and rehearse what you're going to say, because you want to get the words out there. You want to be able to, okay, what am I going to speak to this slide? How am I going to say it? And the more often you do it, you'll pick up certain key things that you said that you think, oh, that was great, and you'll remember it when you do your presentation. So keep rehearsing. Don't be afraid to grab two people, friends at work, or, someone at home or family, and just rehearse to them as well. It's nice to kind of just keep going and rehearsing, and then you'll need less rehearsal as you get better at it. Body language and voice modulation. So very important. I tend to put my hands in my pocket when I present. I've always been told that's not good body language. So try not to stay still behind a podium and hide behind a podium. I know some of us might find that a bit comfortable, and knowing that you can look at your slide, but stick a little bit to the slide, use your hand gestures, and also project your voice too. So another important thing about voice modulation is, if anyone does qualitative work, when you're reading out quotes from patients or participants, invoke that emotion in your voice. Don't just say, this participant said that I've had a really bad day today, and I just really wish it didn't happen to me. Like, that's not really going to invoke any emotion about and really making justice to what the participant said. Really use, this participant said, oh, I've had a really bad day. My symptoms were so bad, I just wish it was just over. That invokes a completely different aspect to an audience. So very important. Handling nerves. Who gets nervous when they present? Yeah? And most, because you put your hand up? I always clap. And it's completely fine. And what do you say about handling nerves, Clark?
Yes, yeah.
Yeah? Do you want to explain that? Because I didn't.
Okay, Yerkes curve, this is a psychological concept, is the optimal level that you need for peak performance. So if you're too low on the curve, you've not got enough adrenaline to perform really well. Too far on the curve, too much adrenaline can't perform really well. So you need to harness those nerves to hit the top of the curve, you now need performance.
Thanks, Clark. We should have just co-presented this. You're not the only one that feels nervous presenting. Everyone at some point in time obviously feels nervous presenting. I felt super nervous when I first presented, but I've done things to help with my nerves, and that's just things that, we have to do as part of research. We do have to present. But there are some things I'm going to go through after that I've done to help with the nerves, and if anyone has any suggestions when I talk about it, feel free to pop in with some suggestions. So I'll go into the things that I do and that I don't do when it comes to creating my presentations and presenting. So I do use a lot of Adobe Stock for my key slides. And I use Adobe Stock not only for images, but if you type into Adobe Stock infographic layout or slide layout and all that kind of stuff, you actually get really good ideas on how to lay out a slide. And you can actually download that image and then put it into, say, Microsoft PowerPoint and use that layout in order to present the information that you want. So I use that using Adobe Illustrator, which I don't proclaim myself being a massive enthusiast with that. Liv is probably 10 times better than me. But you can use Adobe Stock to find layouts for your slides in order to present the information that you want. So it's not just always bullet points, it's something a little bit more fun and interactive to understand. Another one is I do use QR codes on my PowerPoint presentation. So for references, especially if in a presentation, if I'm talking about a specific study and I want to talk about the results and, it's really informed a large part of what I've done, I will put a QR code because I think it's important that you do show acknowledgement that this information has come from a different study. And so QR codes, some people might not like them, maybe people who are, not the most financially, not technology savvy, but a lot of people use them nowadays in their PowerPoint presentations. It's a lot cleaner and neater than using a long list at the bottom of references. And I would usually only use references for big studies that inform the presentation I'm going to do, not for every line in a background. So talking about the prevalence of asthma, I'm not going to use references for that because that generally they're well-known numbers. Next one is I make my content first and I design my PowerPoint presentations after. So I get my slides out, and for each slide I was like, okay, this is one slide selected to my introduction, this is my one slide selected to methods, this is my one slide to talk about, this particular graph, the next slide for another graph, and I do all that and then I design it after. I never go in from the beginning and pick a design and a theme that I like and then make it flow. No, I come after that once I've got the content, because I think it's important to know how long you're going to go for to describe what you want to do, and then the design is an afterthought. Because what's more important about your presentation is your content, because the science is important and then the design is just supposed to help assist with that. Next thing I do is I attend presentations. So, it doesn't matter which format, at conferences or, if HMRI are doing some stuff or Asthma and Breathing is doing something or treatable traits. Attending presentation is a great way to really take home messages. I really love that slide, or I love the way that person presented. I can adapt that into my presentations. So obviously not copywriting their slides, but maybe the way in which they presented it or the way that they spoke or that information really retained for you. Really take those messages and use it for yourself as well. Another one is I don't use animations. I did for this presentation, but I generally don't, especially for very big talks or at a conference or something like that. And the reason why I don't use animations is because they can fail. So technology is not 100% flawless. And I've seen people present where they had animations built in and it's just backfired on them. And it can create chaos. And you've got to be a really good person in order to really keep going with that and be able to still present the presentation that you've got without those animations. So what I do is I duplicate my slides. So if I've got a PowerPoint, I've got bullet points, and if I go, okay, I want them to appear one at a time, I'll make one slide with the first bullet point, the second slide with the first and the second, the third slide with the first, second, and third, and that's how I would do my transitions. And that way you know that that's probably not going to fail on you and that you've actually controlled that situation yourself. So I know people use animations, but yeah, I just don't trust them. Trust issues with technology. Next one is I practice, I rehearse all the time, particularly when it's a new information that I'm getting out there, a new study I have not presented before, new findings I have not presented before. I like to practice, and I'll grab, anyone who's in the office, hey, do you want to listen to me? Can you give me feedback? Or in a team meeting, or in a, with a lot of other people too. So definitely important to practice, and it gets rid of that nerves as well, and that can help with that. I never rely on presenter mode, and I don't rely on notes. And I think this is really key thing that I got taught from the beginning is when you start presenting, just try and start presenting without presenter mode or notes, because one, you don't know if presenter mode is going to be available to you, and you can't rely on that. And so I've seen people where it's like, oh no, can you somehow get in presenter mode, and people are scuffling around trying to make it work. It just, it's not a nice way to start your presentation, and you're already nervous, and you're going to be more nervous knowing that presenter mode is not there. So just remove that barrier, essentially. And I don't use notes for a reason of, if you get lost in your notes, it's very hard to come back. So, and then people will know that you're reading off notes, and it's just like, oh, if you're reading your notes and then you lose your voice modulation and you're not really enthusiastically presenting your information, people will also get lost from that too. So I generally don't use notes, and I'm very thankful for people telling me from the beginning, just don't rely on it, because now I don't rely on it, and it's very easy now to present without having to do that. And you should know your stuff. Someone's told you to present, they know that you can do it, you know, they have that confidence in you, you should have that confidence in yourself. Another one is, and this is my last plug-in, say yes to presenting. Put your hand up to present. So, for example, Asthma and Breathing Learn at Lunch, great forum. Everyone here is very friendly. You know, you shouldn't be nervous in front of your colleagues that you see every day. And, you know, it's okay if you know, muck up saying one thing, everyone will have a laugh and it will be okay. Say yes to present in forums like this, because this is what has helped me to present. Journal Club is another great way as well, with the Treatable Traits Journal Club too. Put your hand up to present. You've got a paper, you want to know how to scientifically present a paper, put your hand up to do it. It will help. It's also surrounded by very lovely people that will help you. And so I really recommend that if someone comes up to you to present, just rip the Band-Aid off, put your hand up and like, yes, I'll do it, because that will help. And that's how I've started to continuously present, just because someone asked me, it was like, hey, do you mind presenting this? And I was like, I really don't want to. I'm so nervous. I'd hate to present. I really want to say no, but I said yes. And then it becomes easier to say yes. So, right, Club? Yeah. When you get patted on the shoulder to do Journal Club. So yeah, those are the things that I've got, and that's basically all I have for today. But I was wondering if there's anyone that they do to help with their nerves when they're presenting to begin with? That I haven't, and beta block is not an answer.
The advice I was given was to nail your first slide, so know your first slide really well, know the key messages you want to say, so then you start out strong, you're like, I've got this, I've got the one. Nail the first slide.
Mm-hmm. Thanks, Clark. Is there any pet peeves that people have that presenters do?
Quiet, messy slide, everything that's not on your slide. When they just read the slide.
Yeah. That's
boring.
Yeah, that's a good one. So, yeah, once you start putting full sentences on your slide, you know your intention is to read that full sentence. Mm-hmm. So bring it back down to bullet points to avoid having to do that. But yeah, everyone knows everyone would be there and be able to read what you're saying, so you're not really adding anything. Remember, slides are there to help you present. They're not to portray the whole information there. So yeah, don't just stand there and read everything on your slide and then next slide and do the same thing.
I think saying is a big one. I think don't say anymore. Let's change it into a moment of reflection, and you don't need to fill in that silence.
Yeah, that's a good one. I also.
Everyone else.
Yeah, but it's a good one. Pause. It's okay to have pauses and to think about what you're going to say before you do it. Be comfortable with a little bit of silence. It's completely fine, and allows the audience to also retain what you've just said too.
A pet peeve for me is not having like a summary at the end as to what the key points are. If I come away from a presentation and I'm confused as to what they were trying to get across, that frustrates me a lot, and I feel like I've wasted my time there.
Yeah.
So as long as there's something that summarizes at the end what the key points of the presentation are.
Yeah. Like bring it back to, you know, a nice summary of the whole layout of the presentation, essentially. Yeah. Or at least, you know, your findings in it. Yeah.
Like you've done really well to say like, draw the eye to the most important point down there, the things that I do and don't, like your main title on each slide. So therefore, like I'm a very visual person, so I'll remember that those like key titles. But in failing that, having like one slide at the end that just lists all the important points that came out of it.
Yeah, that's good. Yeah, I enjoy it when people do that too, because sometimes you might wander around, your phone will kind of go off and you're lost a bit, and so it brings you back to it. Yeah.
Exactly.
Especially like some presentations will have question time afterwards, and I guess something that I see as a bit of a missed opportunity is when people do their presentation and they flick through the slide and they finish their last slide and then it comes up with the black, like, click here to exit PowerPoint.
Yeah.
And then it's left on the black slide while they're answering their question.
Right. Okay.
Whereas they could have a summary as a guide to help them or to help the audience understand their answer.
Yeah, that's great. I've never heard of. Yeah, but that's great. But yeah, I agree when you're trying to ask questions and that, and it's just like click here to exit the screen.
Yeah, it just kind of takes away from, someone can do a brilliant presentation and then when they're engaged directly, like one-on-one with somebody who's asking a question, sometimes having that black screen can take away from the quality of the rest of their slide.
Yeah.
That's just what I find personally.
Yeah, sure.
And I'm glad I'm not the only one that gets spotted by differences in font and colours.
It's all in the detail. Yeah. You don't want to bother one person in the audience.
It's really funny you say that, Alyssa, because one thing that I do as well for presentations is try and predict what questions I get and then try and pre-answer them. So I create my last slide and then I usually have 5 or 6 slides after that answer the specific question and go into a little bit more detail. So where I've taken out the detail in the content and where I've written sentences, shorten them down, I then put that detail into the end of the slide in case someone asks a question on that.
Yeah.
Yeah.
It's a tactic.
And maybe something else just to consider. It's probably less of a thing now, but for me, when I was going through my PhD, I attended multiple conferences that were either purely online or they were hybrid, where people were attending in person but also on Zoom. And you can see even here how like the little boxes where people are online, sometimes they overlap the slide.
Yeah.
And that's not really something that I've considered until being in that environment. We can see that sometimes some information might disappear.
Yeah.
It's being communicated on Zoom.
Yeah.
So just like to check that.
Yeah. I've had that happen to me where people's faces like, oh no, what's that dot point I'm trying to talk about?
And things like that, where you can hide, things about the Zoom window.
Yeah.
Which I learned from a very confronting experience where I was the first person to present in a hybrid forum. And got up there and I was really nervous. And I didn't think to check those things. And then in the middle of my presentation, maybe like my second or third slide, somebody came up and started fiddling with the computer. And then they were fiddling with the microphone and I just had to keep going.
Yeah.
While all of that was going on. And they were things that I was responsible for.
Yeah.
But if you can kind of anticipate that those things might happen.
Yeah. And it's hard to keep going, isn't it, once you're taken off track?
It was really hard, but somehow I ended up getting an award for the presentation. But just be aware of those things.
Yeah.
If that's going to be like part of how the presentation is communicated.
Yeah. Which is also a reason why I try and troubleshoot in advance if things may go wrong, which is also the reason why I don't like animations. Anyone else? Another good one I just thought of was know your audience. So you need to communicate differently based on who your audience is. So this is pretty chilled audience, it's fine, words that I use don't have to be so specific. But if you're talking to someone, say if I'm doing my stuff on sedentary behavior and asthma, if I am presenting to a respiratory audience versus an exercise audience, it would be a little bit different. And then the way that I would have to dwell a bit more about asthma and how people with asthma are impacted by physical activity and that. Whereas, people in respiratory don't need to know as much detail.
I guess it's like that with pulmonary rehab. You mentioned when we were doing it originally, people in pulmonary rehab didn't know what COPD was. We would say, you'd say COPD and they're like, no idea what that is. So it's the way that, I think when I presented yesterday, I actually said COPD, but I broke it down so that they actually knew that what it was. Because we can put all acronyms and all different things on there, but they won't know what it is.
Yeah.
So it's really having to simplify it so that they can understand for that demographic.
Yeah, and that's a key point, using acronyms in your PowerPoint presentations. It's a big no-no, Clark. But be careful about using those, obviously, and who your audience and if they'll understand those acronyms or not.
I think I did a course on presentation, demonstrating calculus. And one of the things that this guy said was, first of all, is engage your audience into something that's common with you and them in your presentation. So almost your slide, I can't remember which number it was, but the one with the table up, which was really hard to read.
Yeah.
That'd be one you'd start Never going to hate that bang, and then delete it.
Yeah.
And you can move on.
Yeah, that's a good one, yeah.
That was an interesting way that this guy suggested you do.
Yeah.
Especially if you talked about the 3-minute thesis. You turn up and you've got 100 venture capitalists there and you've got 3 minutes. And you think, right, well, get these people right.
Yeah, that's exactly right.
What's your list?
And that can also make it a bit more comfortable for you to start off in that way as well. I mean, like, oh, you know, who also hates this? And yeah, it would reduce your nervousness quite a lot by starting off in that way too.
Suddenly they're friends.
Yeah, they're connecting, you get that interaction from the audience also. So I think that helps a lot. Which, depending on the audience, you know, sometimes a joke is okay too. So I like to do that sometimes. Anyone else?
I have a question. So first of all, great presentation. And another thing that I noticed of your presentation especially, you have a lot of infographics.
Yeah.
And I like that. Like, it's so good. But my question is, how much is too much on one slide?
Yeah.
Especially for infographics.
So for an infographic, and Clarky's obviously the infographic queen, but if I use it on my slide, one infographic on the one slide, obviously, and it depends what the key message is. You probably just want to be able to portray one key message from that infographic type of thing. So if I might use infographics for a bit of background, if I'm trying to walk people through the steps as to why this is a problem, and so I use more of a hierarchical kind of infographic and step people through that. So that's a great way of stepping people through, but in a nice layout kind of thing. So those are the times I will use an infographic, and I won't use an infographic on every slide.
Right.
I'll use it like maybe every 2 to 3 slides potentially, type of thing to kind of break it up, because then people would just get sick of seeing it. Yeah, especially like for consistency too, they'll just see that using different regular infographics is not consistent with the theme essentially. As long as the colours are fine, then that's okay. But definitely more so in the background and maybe a little bit of a discussion if I'm trying to summarize everything in one kind of visual aspect. Yeah. Anyone else? Cool, I'm off the hook. Thanks everyone for coming.